So moving on to the second scenario, so we are in an OBGYN clinic. I'm Dima Khreis and my colleague Amal Chehade, and we have a 30-year-old woman who has recently given birth coming to our clinic, and she's concerned about the risk of postpartum depression and wondering if there is a link between breastfeeding and a reduced risk of developing postpartum depression. So she wants to know if breastfeeding can help lower her chances of experiencing postpartum depression. So the concepts we have here are two: breastfeeding and postpartum depression. So my PICO elements are first the population. It's concerning women who have recently given birth. The intervention is breastfeeding compared to not breastfeeding, and the outcome is the risk of developing postpartum depression.
So moving on to the search, and to help my friend, my colleague Dima Khreis in searching her research question. Before moving on to PubMed, so this research question, the type of this research question is causation or association. So we'll go to PubMed, and to have very concise articles to meet our needs in the clinic, and since we have a busy clinic, we'll search through clinical queries. We'll go to clinical queries and we'll search what we want, which is breastfeeding, postpartum depression. Okay, and then we use for the filter, we'll use the etiology, since we are searching for this for the etiology. Okay, and we'll keep it broad for now to see the results we have. We'll click on search. So for now, we have 949 results. Okay, we'll go to advanced to make sure that all the matches and the keywords are met. And these matches and keywords are met, including the breastfeeding and the postpartum depression. But since we have a busy clinic, we want to make it a narrower search. So we'll switch from broad to narrow, and we'll click on search. We have now 303 results, and we want to make it more concise and more narrow. So since we are in the clinic and we want to give the highest level of evidence to the patient, we'll click on meta-analysis. We'll take more filters that includes the female, since we are searching in breastfeeding women, and adults. So now we have 3 results, which I think they are the most applicable, since we are in a busy clinic, that would answer the patient's concerns quickly. Thank you.